NEXT21 has completed algorithm by combining 5 innovative, independent and cutting-edge bone regenerative medicine technologies that have never existed before. With this breakthrough method of bone reconstruction, which was impossible or difficult in the past, this surgery became simple, easy, short-term and less invasive to the patient. Autogenous bone grafting is the gold standard in Japan, but the problem is that it causes new bone defects in the ilium and fibula, which are the bone harvesting parts. In addition, the operation time becomes longer, and the burden on the patient, such as pain due to the operation, increases in 2 places. Allograft DBM came from Bone Bank. Bone Bank system is working in US and EU. But it is difficult to get allograft in the rest of countries. Heterologous bones are bone graft harvested from animals' bovines and are widely used in oral surgery. However, in comparison with NEXT21's tetrabone, this xenograft has inferior data of integration and remodeling in bone replacement comparative trials. The OCP is the intermediate component in bone metabolism. The CT bone is a custom-made artificial bone modeled with a 3D printer based on the patient's CT DICOM data. Shim bone can be mass-produced by injection molding technology, and it is possible to systematically manufacture bones of almost any shape for a bone bank. Autograft, allograft, and xenograft graft have its own characteristics and drawbacks. NEXT21 has developed a method for manufacturing artificial bones using 3D printer modeling and injection molding. We established manufacturing process new bone graft with higher performance, safety, and less burden on the patient. Synthesis of OCP was the world's first crystal synthesized by Professor Monma more than 30 years ago. Tohoku University has continued research on this OCP for a long time and has developed a scaffold by combining it with collagen fibers. It was difficult to manufacture scaffold with OCP crystal as a bone graft, and it was never commercialized. NEXT21 succeeded in mass-producing artificial bones using alpha-TCP, custom modeling with a 3D printer, and injection molding. Synthesis and recrystallization of alpha-TCP in a weakly acidic dicarboxylic acid aqueous solution, an invention by Professor Mama. To create bone graft of arbitrary shape and internal structure, I was able to shape it. CT bone and shim bone are synthesized using common weakly acidic succinic acid. The feature of OCP artificial bone is that it is a physiologically active substance, unlike other materials such as HA and beta-TCP. The effect of this bone induction and blood vessel induction is recently, it has been published in papers that it is very advantageous for bone regeneration. Furthermore, OCP is the ultimate regenerative medicine material for cartilage regeneration by inducing the differentiation of bone marrow stem cells MSCs into cartilage and bone and proliferating them. Autologous bone grafting is a popular bone grafting technique in Japan. But it has the drawback of causing new bone defects and resorbing or losing the transplanted market value bone. With the progress of bone regenerative medicine in the future, it is thought that the paradigm shift will come to bone implant. It is the gateway to bone regenerative medicine, and it is important to collect bone marrow cells in a way that causes little damage. This automatic, self-propelled, rotating screw tube enables bone marrow harvesting with minimal effort for the operator and minimal invasiveness and pain for the patient. The closed sampling circuit system minimizes the risk of contamination. The CT bone's external shape cortical bone part is reproduced with a 3D printer that has the same shape and dimensions as much as possible from the patient's CT DICOM data. The internal structure trabecular bone, cancellous bone, is complicated, and the optimal mimic is created by introducing a cylindrical inclined structure with topology design. It will be possible. Furthermore, by embedding bone marrow collected with giri-giri inside, early assimilation and bone replacement are possible. Flat bones such as the skull and ilium can be three-dimensionally molded as a device to balance mechanical strength, autogenous ossification, and bone replacement. Combined with the Ultraflex mesh titanium plate, safe and reliable bone reconstruction is possible. This mesh plate can also be topologically changed. So dynamic bone reconstruction is possible according to the growth of the growth period. At NEXT21, manufacturing and sales approval for CT bone 3D printed artificial bone and ultraflex mesh titanium mesh capable of three-dimensional deformation. We already have an export license in Japan. We plan to obtain approval for ShimBone in this year and are preparing for mass production. The ability of ShimBone for bone fusion and bone replacement is it is superior to biomaterials and is expected to be more clinically useful than human-derived allogeneic bone bank. Guri automated bone marrow harvesting device is optimizing the design while creating a prototype. The bone marrow collected from the ileum by Guri is either embedded in the bone marrow cavity inside the CT bone, in the trabecular bone structure, or mixed with the ShimBone before being transplanted into the human body. It enables safe, reliable, and early bone replacement, and improves the clinical results of artificial bone grafting. In addition, it is possible to design a physiological three-dimensional biocomponent distribution for various signals and growth factors in an anatomical three-dimensional artificial bone. Ultraflex mesh is used for the purpose of imparting 3D surface shape and mechanical strength according to clinical needs. Bone defects in each clinical area: craniomaxillofacial, spine, upper and lower limbs, joints, fingers, based on 3D image data DICOM from patients' solutions suitable for each data processing. Topology design using AI. Physician can make 3D shape confirmation by 3D printer model for fitting to bone defect. We can fabricate the optimal shape, structure, and components, and provide an artificial bone that can be ideally restored for the patient's bone defect. When artificial bones are required in orthopedic surgery, neurosurgery, plastic surgery, cosmetic surgery, and dental and oral surgery, we will respond to each application and request. On the other hand, by combining NEXT21's independent technology seeds, we can provide the optimal bone reconstruction algorithm for patients in each surgical fields.